Y'all, what's going on? This is J. Marie Booklist. Today I'm making a quick video for Gia Nicole. So Gia asked a question. She said in one of the videos, she placed a comment. She said that she's a CNA, but she's going to become a unit secretary. So she wanted to know what type of interactions would she have with the patients as a unit secretary as opposed to being a CNA. So if she is a CNA slash HUC or a PCA slash HUC, a PUC, that's what they call them. That's where you are a CNA and you are a HUC. It just depends on the type of unit you are on. Usually it's the smaller units. Then you would be expected to do your CNA position and the HUC position. But like I said, it's a much smaller unit you're usually on. But if you're going to be just a unit secretary, so if you're going from CNA to a unit secretary, then your interaction would be different. So before, as a CNA, you would give the patients baths, change them, clean them, walk them, things like that, feed them. Some places I know they draw blood. Some places they do a lot of things. CNAs do a lot of things. You wouldn't do that as a unit secretary, but you still have interaction with the patients. It just all depends on the level. So I just wrote down some of the things that I did as a unit secretary as far as my interaction with the patients. So sometimes I would feed the patients, like if they were alert and but because I worked in ICU, so I worked a lot of places, but mainly it was just like in the ICU. If they were alert and they weren't like aspiration precaution, things like that, I had some time, it was a slow day, then yeah, I can go in there and feed them. You got somebody that's pleasantly confused. They can feed themselves, but they might be fragile. You can go in there and sit with them and feed them. Sometimes we had patients who were NPO, so the only thing they can have is ice. It's just like if we were preparing them for a procedure, or if they had the procedure, things like that, they were NPO, and all they can have is ice, but they were still fragile, but they're with it. They just, can't move like they normally could. Then, we feed them ice and things like that. So I did that sometimes, but like I said, I always made sure they weren't aspiration, they weren't aspiration precaution. And I will always ask the nurse, you just don't go in there feeding people. You just, you ask the nurse and things like that. Sometimes, can raise the bed. The patient could be laying low and they just want their bed raised, the head of the bed raised. It just all depends on what's going on now. If it's like a 40-year-old person, because like in ICU, in the ICU, we did everything for the patients, okay? They couldn't even turn the light on. So you know how in the hospitals they have the controls where you can push the button to call the nurse, and it had the light, and you could turn the TV and raise the bed. Well, in the ICU, it wasn't like that. I think the only thing they can do is push the call bell to call for someone, and maybe turn the TV. I think that's the only thing they can do in ICU. Now on the other floors, they can do everything with the call, with the cord, the call light. They can turn the light on, they can turn the TV, call for someone, raise the bed. But in ICU, they couldn't. And then, a matter of fact, I think, because usually in ICU, they have the buttons on the inside of the bed. So, like, it's actually on the bed and, on the arms, the rails. But I think the inside, it was either locked or it didn't have any on the inside. I think it did, but I think it might have just been locked. And so, we would have to raise the bed. We did everything, okay? And so, if they're a 40-year-old, whatever, and they just want their bed raised, and, you got to know what kind of mindset someone is in. If they're with it, they're alert and orientated, and they just need their bed raised, then you go ahead and do that. And if they can scoop themselves up, then, yeah. Now, I'm not pulling nobody up because I don't know how to pull nobody up, okay? I was useless, okay? Because they put them on a blanket and pull them, and, yeah, no. So, I'm not pulling anybody up, but I will raise the bed, if you want your bed raised so you can eat, things like that. Sometimes wheel patients down, or if they were being discharged, because like we had volunteers in the hospital who would come and when the patient was discharged, we would we would send for it. We would call for the volunteers, and they would discharge the patient. They would come with a wheelchair and wheel the patient out. And but you know, we could do that. We can you know, if they can get in a wheelchair, we can wheel them down. Families out front waiting on them. You know, help them get in the car and go on about our business. We can do that. We can raise the foot of the chair. So like say they're sitting in a recliner and they just want the feet raised, because like in ICU, we had open heart patients. So after they had the open heart the next day, we put them in a chair because they gotta be sitting up. They can't be laying down because they can get a pneumonia laying down. So you put them up in a chair, get them eating, things like that. You know, you gotta get them back to where they were so they can get out of there. And so you know, they be in the chair all day, and like literally in the chair all day. So you know, the feet up, feet down, feet up, feet down. And you know, just depends on the patient, just how they are. You know, if it's somebody who you gotta just be able to know if someone is with it. And you know, and like I said, I will always ask, hey, can I raise their feet up? They're like, yeah. I'm like, look, okay, because I don't know. Okay, I don't know about these people, because sometimes you have orders, you know, this and that, but I will always ask. Sometimes, you know, they put on the call light, you go in the room, they just want their tray set up. You know, you move the table over in front, you know, help them move the table in front of them. Move the table in front of them, put their tray on there, straighten the tray out, put the drinks here, get a fork, whatever, you know, so they can eat. Things like that. And raise the bed, you know, things like that. So, you know, we go in the room, we deal with them that way. We also take blankets to them, sheets, pillowcases. Sometimes they just need, you know, they made a mess and they need a new pillowcase, new blanket. Just take it to them. You know, warm blanket. It gets cold in the hospital. We have warm blankets in the hospital. And you know, sometimes the patients just want you to sit with them. I had a situation where the man, we knew, because you know, we always know, he had cancer. And so finally they went and told him that he had cancer. And the man looked like he had cancer. I mean, I don't know how he had just got the diagnosis. He looked like he had cancer. And so, you know, he put the call light on. I went in the room with him, you know, to see what he needed. And he was like, he said, I got cancer. Can you just sit with me? You know, because he was there by himself. And so I just sat with him. He, you know, because he don't want to be alone. He don't want to be alone. You know, you just got the news that you about to die. And, you know, you dying. Because he was already there for some other stuff, and then, you know, you got cancer too. So, you know, sometimes they just want you to sit with them. So I did that. And then, of course, you know, here in Florida, we have a Baker Act law. That's when a person threatens to harm themselves or others, and, you know, they got to have a one-on-one. They have to have someone in the room with them to make sure they don't harm themselves or others. And so, you know, you sit in that room for your shift. And depending on the patient, I had a lot of patients. 99% were good. I only had one crazy violent one, but you know, some were old. Some, you know, I might have had a few like. Why are they a Baker Act? Because like who they gonna hurt? I mean, okay, they might hurt themselves, okay, but they ain't gonna hurt nobody else. They couldn't even. I don't know. But anyway, like, why are you here? Well, okay. You know. But, you know, sometimes people say stuff. But the one lady, she was, how did that crazy story go? Somebody was living in her attic. I think the lady had mental problems. I don't think it was, I don't think she threatened to harm herself or others. I think she had mental problems. She said it was somebody living in her attic, and her friend was in her house, and it was a weird story. And she told it because she believed it. So I don't think it was, you know, but I don't know how I don't remember her threatening. I don't know, because it was a weird story, and she told it because she believed it. And then she ran over to the neighbor's house and this and that, and it was a weird story. But I think she might have been the only one that was frail, you know, needed somebody to feed her, because I would feed them. Like I did have this one lady who was You know, I walked in the hallway with her. She was a Bakerette, you know, but I walked in the hallway with her because I'm not going to sit there and, you know, if you want to get up and walk, let's go walk. You know, as long as you, because you got one-on-one, it's me and you. So we walking in the hallway. She holding on to me, little thing. They couldn't believe it. They was like, oh my God, she is so calm and quiet. I was like, this little old lady. They was like, that lady raised hell. That lady raised hell, okay? They like, you don't know. Not this little old lady. We walking in the hallway. Not this little lady. They said that lady raised hell, okay? No, not her. Not Senorita. Senorita didn't raise no hell. She raised hell, okay? No, not her. But yeah, they said she did. So, you know, but we were walking in the hallway. She like, hi, talking to people. Okay, she threatened to kill everybody. They said she threatened to kill everybody up in there. I was like, oh, okay. Not her. So, you know, you have all kinds of interaction with the patients. Like when they put the call light on, you know, you can go in the room and see what they need. I used to do that all the time. I remember I'm the one saved this lady life. Lady put the call light on. I said, you know, hi, may I help you? You know, and didn't say nothing. Okay, so then a few minutes later, put the call light on again. Hi, you know, may I help you? Nothing. So then put it on the third time. And I guess, I don't know, because I was the one that was always getting up and going to see what the patients needed. They were like, why are you going in these rooms? I'm like, because they put the call light on, and y'all ain't went yet. And so I went in there. The lady done pulled her tube out her throat. I'm like, if you don't, and now she can't breathe and talk, but she need help. I was like, why are you pulling out, lady? And she wasn't young. She wasn't old. She was a young girl. I'm like, we need a nurse. Hell, we need a nurse. You don't pull it out your, what are you doing? So yeah, they were always like, why are you in these rooms? Why do you get up? Did people need something? You know what I mean? You know how many people, the one guy called and he was like, I'm on the floor. So I got up, I got the charge nurse, she was sitting right there. I said, come, let's go. Cause I didn't want to make a big, you know, I said, come, let's go. And so we go down the hallway. This man could not, he I don't know why he could not walk. I don't know what was up, but he tried to go to the bathroom. Okay, he gonna go to the bathroom. You know, people stubborn. He gonna go to the bathroom. Slid off the bed. We don't know if he slid off the bed, fell off the bed. He just said he was on the floor. He was able to reach the call light that was on the bed, crawl back to the bed, and push the call light, say, I'm on the floor. You know, and, you know, we think he don't fail out the bed. So I don't think he failed. I think he was just trying to, and he just could not. And anyway, he was trying to poop. He had poop all. I was like, oh, Lord. Okay, y'all got this. okay, y'all got this. Y'all nurses, PCAs, y'all can handle this. Okay, let me go back to the desk. But he was like, I'm on the floor. See, you know, you get somebody, you go see what's going on. I was that person. I was the one always getting up, going in the rooms. You know, if somebody just need a blanket and, you know, it's a Saturday and we relaxing, you know, where it's not busy, you know, not a lot of call lights, things going on, I can get up and go give somebody a blanket. It's not going to kill me. But, you know, you have some, they don't, some secretaries don't get up at all. I'm the one that gets up. That's probably why I know so much, because I'm the one that interacts with the patients. As far as like wheeling the patient down, we had this guy in ICU. He was there for a long time. And when I say he was there for a long time, the room stunk. That's how long he was there, because he had all kind of issues, like open wounds and stuff. It was, oh my God. And he was there for a long time, couldn't move. I don't think he was paralyzed. I think he was just too weak. I mean, he was frail, okay? Open wounds, just all kinds of stuff going on. And the room stunk. Like, we had to move him to another room and then because they couldn't tolerate, they just could not take going in that room no more. It stunk that bad. Because, you know, you got the open sores and wounds and stuff. It was just a mess. So we moved into another room, and then, like, they had to take everything down, all the curtains, everything. They scrubbed the walls. I mean, it was just so, get the floor, like, that room needed a good cleaning. And so, because he was there for some months now. And so, one day, because I told them, I said, I had a dream that this man couldn't even talk. Okay, this how, you know, we used to bring him back from, you know, the dead. That's what we did over there. And this man couldn't even talk. And I was like, I went on vacation before I went on vacation, I said, "Oh, I had a dream that he's talking, and he's gonna be in the chair and all that stuff." Because he wasn't even out the bed; he was in the bed, and they were like, "Oh, girl, whatever." And come back from vacation, he talking. But anyway, so finally, he was strong enough to go outside, like get in the wheelchair and go outside, because this man was frail, had wounds, everything, couldn't talk, everything. Took him outside by the water fountain. I wheeled him out there. Wheeled him out there in a wheelchair, just me and him. And he cried because he hadn't been outside in like months. He hadn't been outside in like 4 months. And he cried. That sun hit him. He was just like, "Oh my God," because you've been in the hospital and you couldn't talk. You frail. You got wounds, and now you in the wheelchair. I'm the one who took him outside. Because he apparently gave some of the nurses hell, but once he started talking again, but he was so happy to be outside, and then after that, and then they sent him over to the main ICU, and our charge nurse was like, "Is you crazy?" And she went and got him and brought him back. She's like, "They'll kill him. We don't brought this man back from the dead, and then you sent him over there and get him back over here." She went and got him. I mean, literally, she went and got him because we needed room. He was like the only one because we needed room in our ICU for more, and he was good enough. And that church nurse came and said, "Are you crazy?" Well, you know what? Let me take that back. I don't think we needed room. I think we didn't have enough nurses that night, so we had to transfer somebody out because you had to have the nurses for, and he could go. And our charge nurse went and got him. When she came in that morning, because that was the night shift that transferred him. She came in that morning like, "Where is he at?" And they were like, "In the main ICU." She was like, "They'll kill him." She went right back and got him and brought him right back over. I don't think she had no transfer orders. I was like, "Y'all bold." Okay, but yeah, they would get him back over here. Okay, yeah. We don't brought him back from the dead. Get him back over here. So those are I did a lot of things as a unit secretary, but I was the one. I'm the one that took the initiative. I'm the one. Look. You call 3 times. The first time you don't say nothing. The second time you don't say nothing. The third time I'm going to see what's going on because it's not like the call lights is going off by itself. You keep pushing the button. So something is going on because you're not saying anything. And sure enough, she had pulled the tube out and couldn't breathe and couldn't talk and about to die. And I was like, what? Something is going on. Same thing with they need blanket, they need juice. Ice. Sometimes people just want some juice. Sometimes they just want some ice. You can do that. You don't have to call the CNA, PCA, and have them stop what they doing to go get some juice. You can do that. You can go in the pantry, get some juice, and then take it in the room. Do you want some ice? Okay, I can go get you some ice. Things like that. You can. So we interact a lot with the patients, but the level that you interact with them is up to you. It really is. Like some just don't, but I do. Some just sit at the desk all day, wait for a phone call and chit chat and be on the phones. I don't. I've just never been that type. Never. Even when long time ago when I first started, I was the one to get up and go see what's going on because I got to know what's going on. I need to know who keep pushing this light. You got the patients that are always on the light. May I help you? What? Who is this? Keep pushing this little old lady here on this light. Mama, what's going on? What you need, Mama? Papa, what's wrong, Papa? You on the light? What's wrong? And sometimes they just want you in the room with them. Sometimes they just want somebody in the room. That's all they want. That's all. They just want somebody in the room. So you just give them what you can give them, and then ease on out the room. So for Gia, this is for you. Your interaction as a unit secretary. Like I said, now we had like the unit in the ICU, I worked at the end of the week. We had the secretary that worked at the beginning of the week. She was a CNA because she got trained to fill in for another secretary who was on maternity leave. And then it just so happened that so that one came back, and then so she was mad because she was going to go back to being a CNA. But then the unit secretary on the ICU left, so that position came open. So that's how she got it. And then it was me and her for years. And but our unit, because it was ICU, it was a small unit. Oh, they were happy. They were like, "Oh yeah, we'll take her because she's a CNA, and she's secretary. She can do both. She can help them, help the nurses, because we didn't have any CNAs in ICU. And when she came down, we still didn't. Okay, because they thought she was gonna help, do things. The only thing she did was she would do the post-mortem care. So once they died, she would clean up the body. I don't know why she always did that. They said she always did that. She would clean up the bodies and get them. She would do that. She would be in there with them, and I think she might have liked to watch them do the intubation too, because we always had to intubate people, not all the time, but put the intubation, and she would. I think she liked to watch that too, but she would always get the body ready to go down to the morgue. And I don't know if she. I mean, I would assume she would help sometimes clean the patient, but I don't really. That might have been a once every blue moon. Help clean the patient, help the nurses clean the patient. Might have been, because I never really. The only thing I know that she did that they always said is she would, once they died, she would clean the bodies and help get them ready to go down. But I never really heard them talking about how she helped them with a patient. She might have took one to the bathroom every now and then. I really did not hear too much about that, because I know they didn't, because they were frustrated that she didn't help more, and she was a CNA. So, and then she let it lapse too. She let it lapse. So, and the same thing on the other floor, they had one. She was CNA. They trained her, and then that's when she was being trained when I was leaving, because I went to the ICU, and they kind of made the comment that she wouldn't even help just doing little things. She wouldn't even help the other CNAs. Like if they would say, "Hey, can you come help me? Can you come hold this patient over while I clean?" No. Okay, so even they weren't happy. So the other CNA, not just the nurses, it was a CNA. She was like, "No," because she's a huck now. She's not doing that. So it is what it is. That's why I say I don't know if you're going to be doing both. It's like I said, it's usually smaller units, but if you're just going to be a unit secretary, you will have interaction with the patients. You really will. Sometimes they might just need a little help to the bathroom. You can help them to the bathroom, and then they can do it themselves. And then they can clean themselves and do this, but they just might need a little help coming out the bathroom and back to the bed or back to the chair. I've done that many a times. I ain't wiping no behinds, but I have helped them to the bathroom, and then they can do what they do. So, you will have interaction with the patients. It just depends on how much you're willing to have. And then it also depends on just, how your day is going. If your day is crazy busy and somebody just needs some ice water, but you got 3 admissions and 4 discharges, getting up to go get somebody some juice, it's just, you can't do it. You got 3 admissions right here in front of you and 4 discharges rolling out the door. You can't do it. It just all depends on how your day is. Now, I control my day, and I'm going to explain that in another video on how to control your day, because there are some things you just got to, working in a hospital, it can change at any time. It could change, okay? But for the most part, your day is routine. Now, you had some kinks here and there, but for the most part, you're doing the same thing every day. So you need to be able to control your day. And if you can't, because it's only some things you can control. So whatever you can control, you control. And I'm going to explain that in a video on how to control your day. And it starts from when you walk in that door. All right? So I will talk to y'all later. You can follow me on my blog. It's jmariebooklist.com. Is where I talk about being a health unit coordinator. And I'll talk to you later. Bye.